Hi, this is almost everything you'll need to know about the brachial plexus, part 1. So in every anatomy course there comes an awkward time when we have to talk about the brachial plexus, and this is that time. So the brachial plexus means tangle of nerves, and you can see from this diagram that there certainly is a tangle, but the brachial plexus always tangles in exactly the same way every time. It's very stereotypical, so we can learn it, and the purpose of learning it is then we can understand from each branch, each peripheral nerve, how it's derived, and that means we can figure out which are the nerve roots that it can come from, and then we can apply that to the muscles supplied by the nerve to understand which myotomes are involved, and that saves us having to rote learn tables of information. So we do have to rote learn the brachial plexus, but that's actually relatively easy. So the brachial plexus is formed from the anterior primary rami of the nerve roots from C5, C6, C7, C8, and T1. And these nerve roots combine in this way: the top two, the first two combine, 5 and 6, 7 remains on its own, and 8 and T1 combine. And that gives us 3 trunks. So it's a sort of arboreal nomenclature. Roots combine to give trunks. Trunks back to roots. So nerve roots have formed trunks. Each trunk divides into 2, so these are the divisions, but again it's sensible naming. And there is an anterior and a posterior division from each trunk. The trunks are named, I should say, superior, middle, and inferior. So again, not too technically difficult. There is a posterior division and an anterior division, this color, from each trunk. The 3 posterior divisions combine. So we'll draw the posterior divisions in this color. And their combination into one chord is the posterior chord. The anterior divisions recombine in such that the one from the middle trunk and the superior trunk combine to form a chord, and the one from the inferior trunk just carries on to form its own chord. And chords, therefore, 3 chords formed. The chords are the lateral chord, laterally, the posterior chord here, which is the recombination of the 3 posterior divisions, and the medial chord. But in fact, the chords are named for their relationship to the axillary artery, which comes to entangle itself in the tangle. So the artery would be running like this amongst the chords after it crosses the first rib and enters the axilla. So we see that the posterior chord, for example, is posterior to the artery, and so on. So the point of learning this is that, again, for example, any branch of the medial chord that hasn't combined later on can only be derived from C8 or T1, for example. Same with the lateral chord, it can only have come from C5, 6, or 7. The posterior chord is a bit more difficult because it receives input from all 5 of the nerve roots, but even then there are ways to narrow down which nerve roots are involved in any structure that is innervated from the posterior chord. So to recap, there were 5 nerve roots. They combined to form 3 trunks, each trunk divided into 2, and the 3 posterior divisions from the 3 trunks combined to form one posterior chord. The upper two anterior divisions combine to form a lateral cord, and the solitary remaining anterior division of the inferior trunk formed the medial cord. We'll have a go with an official diagram, just so you know it's true, maybe. So C5, C6, C7, C8 and T1 nerve roots combining, C5 and C6 forming a superior upper trunk, C7 just carrying on for the middle trunk, C8 and T1 forming the inferior trunk, each trunk dividing, the three posterior divisions recombining to form this posterior cord, the upper two combining to form a lateral cord, and the lower one carrying on to form the medial cord. Medial cord, posterior cord, lateral cord. We'll draw that again with some skeletal structures for reference. This is T1 because it has a rib. This is C7, 6, 5, 4. Initially, this is a bit of an awkward occurrence, but initially the nerve roots are named as they come out superiorly from the vertebrae. So this would be C5, C6, C7, and C8, but there are 8 cervical nerves, but only 7 cervical vertebrae. This one has to be called T1, the first thoracic nerve, because part of it, the part that doesn't join the brachial plexus, becomes the first intercostal nerve. So by definition it must be a thoracic nerve, but that left 8 cervical nerves and only 7 cervical vertebrae, because the first cervical nerve comes out between C1 and the occipital bone. Awkward, so that's the reason for that. Anyway, T1 and C8 combine, C7 carries on, C5 and 6 combine. We have 3 trunks, inferior, middle, and superior, each dividing. The posterior divisions, which we're going to call these ones, forming a posterior cord. The 2 anterior divisions from the upper trunks, if you like, forming a medial cord, a lateral cord, and this one just carrying on to form a medial cord, arising out of the thorax and getting itself involved. We can perhaps draw the carotid. For fun. So hopefully that's been informative. It's not the whole story of the brachial plexus, but it's a good start, and it's best to take it in stages. Yikes. Better go. Have a practice at that. Just draw it a few times, check that you've got it right. If you haven't, draw it again. Make sure you can draw it 5 times, let's say, accurately. Then hopefully you'll have burned it into your brain, and we'll move on to part 2, which is all the branches. Yay! Until then, enjoy the rest of your day.